All right, well, I'm Dr. Katie Brown. I just go by Katie. If I've seen you before, you already know that. And I am an audiologist, a doctor of audiology, and what that means is that I specialize in diagnosing and treating problems relating to the ear. And some of those problems are hearing loss, balance problems, dizziness, and those kinds of things. And some of you know that I like to talk a lot about hearing loss, but I decided to mix things up today to talk about dizziness and balance problems because just as hearing loss is something that many people experience, many people also experience problems with dizziness and balance. Excuse me. So that's what I'm going to be talking about today. So today is going to be kind of a general overview of diagnosing and managing problems of dizziness and balance. So here we go. All right, so just some statistics, just so we can kind of see how widespread these problems are. About 70% of the nation's population at some time in their life experience dizziness or a balance problem. 70%, that's a lot of people experiencing these problems. And 65% of individuals over 60 experience dizziness or loss of balance, sometimes on a daily basis. And with that, of course, if someone's dizzy or having balance problems, that increases the risk of falling. And falls are the leading cause of injuries over people the age of 65, with 30% of people over 65 falling. Okay, and that's, again, a very staggering number. And 10% of patients who have a balance problem have actually been evaluated by a specialist. So maybe they've mentioned it to their doctor, but really haven't gotten any additional care for their symptoms. So when we talk about dizziness and balance problems, these are some of the symptoms that people report to me. They feel like the room is spinning. They feel like they're going to faint. A disequilibrium, which we'll talk about in just a moment. Feeling disoriented, or sometimes people just say, I just feel off. I'm not like I used to be after this all started. Feeling motion sensitivity, or feeling like you're moving when you're standing still. Just losing your balance, falling. So any of those things. And some of you, probably many of you, have experienced some of these symptoms. So I wanted to talk a little bit about some definitions because many a time patients will come in and they'll say, well, I'm dizzy. And dizzy is actually a very unspecific term. It just means that you're experiencing a problem that could be a vertigo, lightheadedness, instability, lack of mental clarity, any of those things. But it's not very specific. It doesn't tell me anything about what could possibly be causing those symptoms, which is why I always try to get a little bit more information about what the symptoms actually are. Is it a spinning feeling? So do you feel like you're on a merry-go-round? That is called vertigo. So if you've ever been told you have vertigo, it just means that you have reported that you feel like you're spinning. Imbalance is just a generalized unsteadiness when you're on your feet. And disequilibrium, that's the way that I usually describe this, is it's kind of that feeling of having had one too many alcoholic beverages where you just kind of feel like you're not where you think you should be. But it can also cause a sensation of impending fall, or where you feel like you need to just touch something to get a little bit better stability. So when we go through this presentation, just think of those definitions when we refer to those terms of disequilibrium, vertigo, and instability or imbalance. All right, so to talk about problems with dizziness and balance, we have to talk about what normal balance entails. And so as you can see on my little graphic here, normal balance requires integration from 3 different sensory systems, from your vision, your inner ear, and your somatosensation or your proprioception. And that is all the information that your feet, ankle joints, knee joints are sending up to your brain. Your brain coordinates this information together, and then it uses it to make you a stable person. And that's what's happening when the system is functioning as it should. when some of those systems are not functioning as they should, that's what causes imbalance and can sometimes cause dizziness. And so sensory disturbances such as loss of visual information, so vision loss, macular degeneration, any problems with your vision can impact your balance and stability, as well as a problem with the inner ear, which is the vestibular system, or those somatosensory cues, so decreased sensation from your feet or impaired signals from those sensory systems traveling to your brain. If you have stroke, migraine, seizure, MS, that can affect how those signals are being interpreted by your brain and being sent up to your brain, so that can lead to imbalance. And then if you have spinal cord problems, that of course can change how the signals are being transmitted up to the brain. And so those are just some of the general causes of imbalance. And some of the causes of dizziness, this is a bigger list. And that's because there are so many things that can cause dizziness. There are things that are in the ear, so those are called otologic sources of dizziness, and we're going to go into more of those a little bit later on. Psychological, so some people have fears, anxiety, depression, or phobias that could lead them to feel dizzy or off in particular situations. Of course, there are also central or neurologic causes of dizziness. So if you have a stroke, migraine, seizures, tumors, that can lead to dizziness. And then some medical causes, low blood pressure, low blood glucose, or blood sugar problems. Medication sometimes can cause dizziness. And so those are all things that are on the table when I see someone who has dizziness. It's a matter of figuring out what of these things it is not, so that we can figure out what it is. Now, when we're talking about the causes of dizziness, this is a neat little graphic that shows that about 50% of all causes of dizziness are related to the ear. Okay. And then broken down, about 25% is unknown. About 5% is central, 5% is medical, and then about 15% is psychological. So that's why it's so important that if you do experience problems with dizziness or imbalance, you do talk to your doctor about it, because there are these are problems that can be addressed. It's not something you have to suffer through. It's not something that, well, I'm getting older, so of course I'm dizzy and have balance problems. It's not something that has to be that way. And so it's important to talk to your doctor so we can start to identify what the source of the symptoms are, so we can work on improving them. So in the assessment process, we have goals of, first and foremost, to rule out any serious underlying disorder that could be causing the dizziness or balance problem. And so those would be the medical things, like, was it a stroke? Is there something going on with the heart? Is there another problem in the body that could be of serious medical nature that we need to rule out before we look at the things that are maybe less serious? Then we want to identify the nature of the symptoms. So is it a true vertigo? Is it a syncope? Is it another form of dizziness or balance problem? And then we work to identify the origin of the symptoms. Okay, we know what it is, but what is it coming from? What is causing these symptoms to manifest for a particular person? And then figuring out, okay, well, this is what it is. What do we do about it? How do we make the person more functional? How do we increase your quality of life, reduce your fall risk? All of those things are very important in this overall process. So it is a team approach. It does take the part of the primary care provider to say, okay, let's investigate this a little bit further. And then the team that investigates dizziness and balance problems can include an audiologist. It can include a physical therapist, an ear, nose, and throat physician, sometimes a cardiologist if there are suspected cardiac problems, or other specialists. Sometimes thyroid issues may cause some dizzy symptoms, in which case you would see a specialist in that regard. And we kind of work together collectively to narrow in on a diagnosis for someone who's having these problems. And so we can work together on, of course, remediating those problems. So my role as an audiologist in this team of diagnosing and treating dizziness and balance problems is to provide a full range of diagnostic services for people who have these symptoms. So that means diagnosing any hearing loss that could be present and analyzing the vestibular system. Participating as a member of that team, okay, to provide my insight as to what the problem could be, and to indicate some possible treatment options for somebody with these symptoms, and to provide counseling to the patient on what we are thinking the symptoms could be from, what the next step is if we don't know, and to just kind of help guide the patient to understand a little bit better about what's going on with their symptoms. And then provide recommendations for follow-up care. So many times, if I have seen you before, if I haven't seen you, either way, I like to kind of guide what we're doing next. If I do feel like, based on our test findings, that you should see a neurologist or another specialist, or just go back to your primary care doctor and have a discussion about X, Y, Z, I will let you know that, so that you can leave knowing more than you did when you got there. So I'm going to speak a little bit more about the otologic conditions that can cause dizziness and balance problems, because of course that's what I know the most about. And so I always start this sort of discussion with an anatomy lesson, because many people don't know a whole lot about the anatomy of their ears. And it's important to understand this anatomy when you're dealing with these problems. So this is your ear, and the ear consists of your outer ear, which is your pinna, the part that you can see hanging off of here, and then your ear canal. And then at the end of your ear canal is your eardrum. Most people know that far. Behind your eardrum is your middle ear. It's an air-filled space with 3 little bones that are called your ossicles that help transmit sound through your ear system to your inner ear, which is this little guy here. And we're going to blow up the inner ear. This snail-like portion of the inner ear, that's your cochlea, that's the organ of hearing. We're not talking about that today. We're talking about your vestibular system. So this right here, those canals that you see, as well as what's called the utricle and the saccule, are the parts of the vestibular system that are responsible for maintaining our balance. Okay. Now, when I see patients who are suffering from dizziness and balance problems, the first thing that I do is say, okay, what brings you in to see me today? And then that starts a discussion, a pretty lengthy discussion, about all the symptoms that someone is experiencing. And that really involves all of the things that you see in this list. We talk about, when did the symptoms start? Was it a sudden onset? Was it gradual onset? How often do they happen? And how severe are they? Have they gotten better over time, worse over time? Are they the same now that they were when they started? What is the time course of the symptoms? Do you get dizzy and it lasts for hours, or does it just last a few seconds? Is there anything you can do to make it better? Do you lay down to make it better? Do you take an aspirin? Do you do nothing? Do you hold on to something? And what initiates these symptoms? Is there every time you bend over to pick something up you get dizzy, or when you lie down in bed? And so all of those things are very important, as well as any associated symptoms. So changes in hearing, ringing in the ears, or any other sounds in the ears, pressure in the ears, even neurological symptoms. So if you have numbness on one side of the body when this all happens, any of those things are very important to diagnosing what these symptoms are originating from. And then we also talk about other medical history. So if you have diabetes, if you have a history of cardiac problems, maybe you have a pacemaker, anything else that could be relevant, or even things that you may think are irrelevant, could be relevant to the full picture when we're trying to identify the source of these problems. And then a review of medications. There are many medications that can cause dizziness There are many medications in combination with other medications that can cause dizziness. And also a number of medications that can increase your risk of falling. So it can reduce your balance or reduce your response time if you were to trip or fall. And all of those things are important to evaluate in this process to determine if they could be having an impact on a particular person. So after the case history, I will determine based on our clinical questioning what sort of testing would be appropriate for a particular individual. And so I'm just going to go over some of the tests that we have in our little toolbox to diagnose and treat these conditions. And so these tests involve audiological evaluation, and we're going to talk more about all of these in just a moment. Video nystagmography, say that 10 times fast. Dix-Hallpike testing, and then other testing that's not necessarily diagnostic but can be very important to our treatment plan is called computerized dynamic posturography. And so we're going to talk about all 4 of those right now. So a hearing test is important when we're evaluating someone for dizziness or balance problems because, as you saw before, the auditory system is housed so very closely to the vestibular system. They're in actually the same apparatus. And so what we find is that some causes of dizziness and balance problems may also have an effect on your hearing ability. And so that's why we do a hearing test, to kind of get a whole picture of your ear system to determine where the problem is and to determine what the possible cause of the problem may have been. So the hearing test is just, it's a comprehensive evaluation that can quantify the hearing loss and determine where in the auditory system the hearing loss may be. And it can also help support a diagnosis for dizziness and balance problems. The next set of tests that we do is called video nystagmography. We abbreviate that VNG. And what that is just where we use video goggles, like you can see that woman wearing down here. And those video goggles record your pupil movements as we go through a series of different tests. So they just kind of watch what your pupils are doing. We have you completing a series of tasks, and then we analyze your results to see how you compare to normative data, so people your same age who did the testing. And so the testing is comprised of ocular motor testing, and that's just watching lights on a bar as they sit still or move around. Positional testing, which is analyzing what your eyes are doing when you are in different positions, so sitting, lying down, turn to the right, turn to the left. And then caloric testing, that's usually everyone's favorite. Caloric testing involves me irrigating the ears with very warm and cool water, which is intended to stimulate the inner ear system, and it causes a vertigo. And it gives us a really nice picture of how the inner ears are responding to stimulation. So that's one of the tests that's probably one of the most important things that we do to determine if there's a loss of function. If there is it on one or both sides? And then kind of go from there if we do find an abnormality on that testing. And so this, with the audiological evaluation, can help shed light onto where the dysfunction is if we do measure dysfunction, and can help guide treatment based on our findings. Positioning testing is a little bit different than positional testing. And this is testing to look for BPPV, which is an abbreviation for benign paroxysmal positional vertigo, which is a very long term, which is why we call it BPPV. And BPPV is a condition where you have free-floating crystals in your ear, but they end up in the wrong place. They end up in those canals rather than in the utricle and the saccule where they belong. And it's really important to recognize this sort of cause of dizziness because it's really common. It's one of the most common causes of dizziness that someone may experience. It's really easy to treat without any medication, and it can avoid unnecessary testing. So if we know that it's crystals out of place, we might not have to put you through the caloric testing and the video nystagmography. It's a lot easier to kind of get right at the cause of someone's symptoms if we're looking for this condition. So some of the symptoms of BPPV, what people report is that, well, when I lay down in bed, I get vertigo that lasts about 10 seconds, and then it's gone. Or I get it when I turn over in bed. Some people get it when they look up or bend over. And it usually lasts just a short duration at a time, and it resolves on its own. And this condition can usually be diagnosed based upon symptoms alone without even having to do a test, but you have to do the test to do the treatment, so that's where we usually end up anyway. But the neat thing about this is if this is what your problem is, it can be treated in the office at the time that you are getting your testing done, and the treatment can be very effective for you for relieving the symptoms. In about 70 to 80% of patients, the cure is immediate, so they go home and they're fine. In about 20 to 30%, the symptoms do recur because those crystals maybe don't get set back exactly where they should be, or they don't stick in place. And about half of people will have a recurrence of BPPV if they've had it before. But either way, sometimes we can give you guidelines to self-treat or just information on who to contact if it does come back so that you can get help in a timely fashion so you don't have to deal with that dizziness. Now this is the test that I mentioned that's not necessarily diagnostic, so it's not giving us really any information about a particular part of the body or how it's functioning. This is a test that looks at the sensory organization of those 3 different sensory systems that we talked about at the beginning that help us balance. So our vision, our proprioception, the signal coming from our feet, ankle joints, knee joints, and our inner ear contribution. Okay. So how many of you have been in this machine before? Any of you? It's a crazy kind of machine, but so you're strapped into this machine and you go through a series of different tests that will be causing you to rely on your different sensory systems. So for one part of the test, you're standing there and of course you're strapped in so you're nice and safe, but you stand there and you close your eyes. And the foot plate measures how much you are swaying, okay? So it can determine how well you balance when your eyes are closed. And then for part of the testing, that foot plate becomes a little unstable. So then it measures, okay, well, how much is your inner ear contributing to your balance and stability? And so it can kind of separate out those different sensory systems so we can determine how your brain is using that information. And it's really valuable for the treatment part of identifying these dizziness and balance problems because it can shed some light on how the information is being integrated by your brain. All right, so we saw this list before, the otologic diagnoses or causes of dizziness. And I'm just going to elaborate just a little bit more for you. As we talked about BPPV, that's where those crystals come loose. The crystals are usually sitting right in the utrocolon saccula, which are located in this part of the inner ear. But when they break loose, they get into your semicircular canals and are affected by changes of head position in regard to gravity. So laying down, turning over in bed, as we talked about just moments ago. Vestibular neuritis is a condition that's caused by usually a viral infection of the nerve coming from your inner ear. And what people tend to report when they have this condition is a sudden onset of vertigo that maybe decreases in severity over the next few days, and thereafter maybe they have some disequilibrium or some generalized instability when they're on their feet. Acoustic neuroma is when there's a growth on the auditory nerve, and that can sometimes be the origin of someone's dizziness or balance issues. And then just a few others. Many people have heard the term Meniere's disease. What that condition is a problem with fluid buildup in your labyrinth. So your inner ear system is full of fluid, and sometimes that fluid is not being regulated properly, and it can cause symptoms of fluctuating hearing, roaring tinnitus, or roaring noise in your ear. It can also cause vertigo that we've talked about. And so it's something that definitely needs to be diagnosed if it's a problem. Many people have either heard of Meniere's disease or have been diagnosed with Meniere's disease, but don't have those symptoms. And so it may mean that there's some other underlying cause of the dizzy symptoms. And I also wanted to talk briefly about some other diagnoses that didn't really fit anywhere else in this presentation, but one that we see very often is cervical dizziness, cervical problems. So if you have a history of neck issues, whiplash injury, or spinal problems, degenerative disc, that can cause dizziness and balance issues. All of the information from your body has to go through your neck to get to your brain, and so that can impact the traveling of the information. As well, you have receptors in your neck that respond to posture and can be aggravated if there's pain in the neck or a problem with how the nerves in the neck are conducting information. So that's something that's also a factor in dizziness and balance issues. And then I put non-specific on here because there are a lot of times when we are not able to put our finger on what someone's problems are. Say someone has unsteadiness, but all of their vestibular testing is normal hearing. Many times what I counsel people is that it could just be a problem with how your brain is integrating the information from those different sensory systems that we talked about. It may not be something we can actually put our finger on and say, this is where the problem is. It may just be with how your brain is using that information, and maybe it's not using the information as effectively as it did before. And so that can also help guide treatment. So what it boils down to is that there's really no one place, no one-stop shop for dizziness and balance diagnosis and rehabilitation. And while we all wish that the process is as short as possible, it sometimes can require collaboration between different providers and specialists to determine exactly what someone's symptoms are being caused by, so that we can guide treatment the most effective way as possible to restore function in a timely manner. So when we're trying to manage dizziness and balance problems, of course that does depend on what the cause of the symptoms are, if we're able to identify the cause. But the management includes discussing what the problem could be or what the problem is with the patient and the patient's family, so that there's a general understanding of what's going on. And then correcting any medical contributions. So if you're lightheaded or dizzy because of your blood sugar, then obviously we want to make sure that that was corrected. I've had patients who were evaluated at the clinic who maybe were eating one meal a day, and it was at the end of the day, and they were dizzy all day long until they had their meal. And so that would be a matter of fixing that issue, making sure that they're eating 3 times a day at least, so that they're not going without drinking or eating all day long. But fixing any medical issue that we know could be a contributing factor. And there are drug treatments as well for symptoms of vertigo, and if people have nausea or vomiting. It is important, though, for patients not to rely on those things as a crutch, because many times patients will come into the clinic and they will have taken meclizine for their dizziness for 6 months, 3 times a day. And meclizine is a central nervous system suppressant that can reduce dizziness, but what it also does is it suppresses your whole central nervous system. And what can happen then is it can cause problems with how your body is adapting to those symptoms and how your body's recovering from those symptoms. And so I never like to see prolonged use of those medications unless it's indicated after all the testing is completed, after we've kind of exhausted all possibilities. And then, okay, if it requires medication to prevent those symptoms or to keep them reduced, fine, but let's make sure we look everywhere first before we're doing long-term treatments of those medications. Sometimes psychological intervention is recommended. So if somebody is having anxiety-induced dizziness or balance issues, that's something that we would need to address on that front with a psychiatrist or with a counselor, depending on what is causing the onset of the symptoms. And then this last bullet here is physical therapy. So I work very closely with several physical therapists who do treatment rehabilitation programs for people suffering from dizziness and balance problems. And that's what I'm going to talk about next. So when you see the physical therapist, and sometimes this is after we've done the audiological diagnostic, sometimes it can come before. But the physical therapist can prescribe a series of exercises that are designed to decrease your symptoms of dizziness and can decrease symptoms of motion sensitivity and increase balance function. And the treatment plan that the physical therapist designs for a particular person may consist of, as you see here, gaze stabilization exercises, which are exercises that are designed to improve vision while your head is in motion. That's very important to be able to do that, to be able to see clearly when your head is moving, because we are constantly moving. We're never really just sitting still all the time. Habituation exercises, which are exercises aimed at improving the tolerance of the dizziness, the dizzy symptoms and what's provoking those dizzy symptoms. Generalized balance exercises, so working on your balance and stability. Sometimes that does involve working on your core strength, so the muscles in your abdomen, and working on posture, as well as gait training, and sometimes also performing the treatment for BPPV. So the therapy program designed by the physical therapist is going to be specific to you. It's going to be directed specifically to your functional assessment that the physical therapist performs with you at your evaluation, and targeted to the activities that you want to do on a day-to-day basis. And the goal of rehabilitation is to restore your balance function as much as we can, to reduce dizziness, to decrease your fall risk, and of course, most importantly, to improve quality of life. All right, so that was kind of a huge overview of the diagnosis and management of dizziness and balance problems, but I'm just going to, in review, there are a ton of different things that can cause dizziness and balance problems. As we talk about, it can come from the ear, it can come from a medical problem, and so that's why it's so important to discuss any of these issues with your primary care doctor so that they can be informed and so that they can help guide you so you can receive treatment for your problems. Diagnostic testing performed by the audiologist can help shed some light on what someone's problem may be, what may be causing the dizziness and balance issue, or can help guide treatment or further recommendations for specialties that could shed some light on what is causing the problem and how it should be best treated. And the most important thing is that treatment is available, okay? And it's not something you have to just suffer through. Well, you know, I'm getting old, so I need, you know, so I'm just going to be off balance. I'm just going to be dizzy. It doesn't have to be that way. There is help for you, and it's something that I'm very passionate about. The physical therapist in the Dizziness and Balance Center are very passionate about improving your quality of life so that you can do the things that you maybe aren't able to do any longer because of these symptoms. Several years ago, Kingman Regional Medical Center developed the Dizziness and Balance Center, and so that does involve me, myself, and a physical therapist, and several physical therapists actually, who do diagnosis and treatment for these problems. Our location currently is in the Old Doctor Surgery Center on Sycamore Avenue. Audiology is in Suite A, physical therapy is in Suite B. And if you do have concerns that we've talked about today and would like to be evaluated by our center, we do prefer you to talk to your doctor so that we can keep them informed, so they can look at some of the things that may be on the medical side and rule them out. And then we would be more than happy to evaluate you and give you our opinion and guide you for treatment for your symptoms. So I think that's all I've got for you. So we'll take a few questions. Yes?
During the dizziness, what causes the eyes to flinch?
That's a very good question. Yeah. Okay, so the question was, when you get dizzy, what causes your eyes to kind of bounce around? Your eyes and your ears are connected, so any movement of your head causes an equal and opposite movement of your eyes. That's how you can still see clearly if you move your head back and forth. And so what happens when you have vertigo, for example, for some reason your ears are telling your brain that you are turning, okay? And when you are turning, so if I were to sit in a chair and spin around, what happens is one of your inner ears starts to fire more, the nerve in your inner ear, and the other one kind of shuts down. So that's what sends a signal to your brain that you are turning. That's what's supposed to happen. But when you have an inner ear problem, your inner ear may not be working anymore, so then the other one's saying, okay, I'm over here. And that's what's causing you to feel like you're turning, and that's what's causing your eyes to think that you're turning. So that may have been a little bit more detailed than you liked, but it's because of that connection between your eyes and your ears and what's happening to cause the dizziness to begin with. So we'll talk. Any other questions? Yes?
Is there a good definition that you can give between the difference between dizziness and, say, pain?
Dizziness, so the question was, is there a good kind of separation between dizziness and fainting? And dizziness, I would say, is probably just the umbrella that fainting could fall under, or feeling faint, where feeling faint itself is kind of a response. It could be low blood oxygen levels, it could be a number of different things, but it's where you feel like you may lose consciousness. So dizziness itself just means that you have one of the symptoms, like vertigo, loss of balance, disequilibrium, but the feeling faint would be kind of a more specific definition of what you're experiencing.
Is it fair to say that dizziness involves disorientation, or faintness may not?
Yeah, I would say that it definitely can. Yeah, disorientation can definitely fall under that dizziness umbrella. Yeah. Yes?
What causes clicking in the ear?
Clicking in the ear can be caused by several different things. It can be a true tinnitus, which is just a sound that your auditory system is producing somewhere along from the outside up to the brain. Or sometimes it can be your eustachian tube. There's a tube that connects your middle ear, so that's back behind the eardrum, to the back of your throat. And it opens when you swallow, yawn. When you pop your ears, you're opening that eustachian tube. And sometimes people's eustachian tubes can be a little floppier than others, and it may cause clicking. So it's possible that could be, if you're experiencing a click, what it could be from. Yes?
Having a crystal dislodged in an ear through a severe injury to a head.
Yeah.
Can that be cured?
Yeah, so if you have crystals that are out of place, it definitely would be worth undergoing the treatment or the diagnostic for that, so the test where we lie you back and evaluate if you do in fact have crystals out of place. But in most cases it can be treated.
And also with any of these places that you could go to get help, are they covered by Medicare and supplemental insurance?
I can't speak for any of the other clinics in town, but I do know that our physical therapy does fall under your insurance. So if you have Medicare and a supplement, then you might not be required to pay anything except a copay.
And this physical balance center here, these addresses, this is in the building here, if I'm not mistaken.
It's not here anymore. It did used to be, yeah, but currently we're located off Sycamore Avenue.
Yeah, I started there. But very disgusted with their treatment. I quit them.
Well, I do apologize for that. Any other questions? Yes.
Can like a blow to the head from a car accident or concussion from playing sports, pro sports or college, can that cause vertigo or dizziness?
It definitely can, yeah. So the question was, can a blow to the head or concussion cause an onset of dizziness? And that's actually one of the more common causes of like the BPPV is a blow to the head that just kind of spills the crystals out from where they belong.
I know a lot of pro athletes get concussion. Blow to the head.
Yeah, and that definitely can cause dizziness. Yes.
What are those crystals comprised of?
They are just calcium carbonate, so they're just made of calcium. Yes.
You can get the crystals back in place?
So in most cases we can, and the treatment for crystals being out of place is just a series of different positions that we move your body into, well, we move your head into, but it does involve body positions as well to get those crystals back where they belong.
Does that cause vertigo?
Does the testing?
Vertigo?
The diagnosing and treatment for BPPV can cause vertigo, yes. While the procedure is happening, so while we're doing it.
Yeah, but the crystals being out of place, can that cause vertigo?
Yes.
Okay.
People who do have peripheral neuropathy, they are at an increased risk of falling because you don't have the cues coming from your feet that you did before. And so one thing that I know if you are seeing a physical therapist, what they'll work on is strengthening those other modes of sensory input. So improving the use of the vestibular system or the use of visual cues to kind of help counteract the disturbance to balance that the peripheral neuropathy causes. That being said, you may still have a balance problem because of the neuropathy, but it can help improve your use of your sensory information and can hopefully help at least a little bit. So Meniere's disease, as we kind of talked a little bit about briefly, is a condition of regulation of fluid in your inner ear system. And the diagnosis of Meniere's is usually made based on a cluster of symptoms that somebody may have when they get these what are called attacks. And so people who have Meniere's disease find themselves having attacks of sudden onset of vertigo, usually with pressure or fullness in the ear and a roaring sound with fluctuations in hearing sensitivity in one ear. Sometimes Meniere's disease can be in both ears, but it's a very, very rare condition, and it is almost always just in one ear. Treatment for Meniere's is usually aimed at regulating the fluid buildup, and so can be a prescription of a low-salt diet or a diuretic to prevent that fluid buildup. Any other questions about, was that a good overview? Okay.
So you diagnosed that in an audiology facility?
We can do tests that can suggest that you may have Meniere's disease, but our particular facility, we do not diagnose Meniere's disease. That would be something that an ear, nose, and throat physician, because they're a medical doctor of the ear, would diagnose for you. Yes.
I was told years ago, no caffeine, no salt, and of course at that time there was no smoke.
Mm-hmm.
And it really helped.
Yeah, for Meniere's disease?
They didn't give it a name, but
Okay.
I've gone through all the testing.
Yeah.
But now I got the whole thing back.
Uh-oh. Did someone have a question over here? No? Yes.
How would the diuretic go to that ear, not that ear, not the big toe, or not?
Well, it would just be a generalized systemic treatment to prevent the fluid buildup in the ear.
So you don't do anything to the ear then? You don't put something in the ear to help that?
If those treatments are prescribed by the treating physician, then no, you wouldn't put anything in the ear. But the surgical treatment of Meniere's is to ablate the ear, so just kill the inner ear so it's not functioning any longer. Sometimes primary care doctors do feel comfortable treating problems of dizziness and balance, and sometimes they will want to refer for additional testing. So it's going to be the decision on the part of your primary care doctor what they feel like they need. If they want diagnostic testing from an audiologist, you'll come see me, and I will likely recommend physical therapy. But your primary care provider may have their own guidelines for how they like to treat patients with dizziness and balance problems. We have seen, though, patients, I believe, from almost every provider in town. So they do know of us, and I think they utilize us very effectively for patients that they're not able to determine a cause of the symptoms or resolve the symptoms. But if you do have issues that you either have talked about with your doctor or have not yet mentioned to your doctor, you can always mention coming to the Dizziness and Balance Center for evaluation if it's something that they don't mention to you, and ask for a referral.
Do you need a referral?
For dizziness and balance, yes. Yeah, most insurances require it, and I like to have it for my testing because I like to know that you've already been evaluated for those medical things that we know could cause dizziness and balance problems by your primary care doctor before we start to look at things that are less severe. Most medications do list dizziness as a side effect, and so just taking them can increase dizziness. But there are many medications, so your central nervous system suppressant medications, pain medications, depression medications, anything that suppresses the central nervous system can increase your risk of falling, just taking that alone. But then taking more than 4 prescription medications, regardless of what they are, can increase your risk of falling as well. So it could be the effects of the medication. If it's a sedative medication, can increase your risk of falling, cause dizziness, but also taking many medications can increase your risk of falling.